Today's presentation is on CMS star ratings for hospitals. The overall hospital quality star rating shows how well each hospital performed in comparison to other hospitals in the US on average. The star ratings can range from 1 to 5 stars. The more stars reflect the better performance of hospital on the available quality measures. When selecting a hospital, consumers can look at the overall hospital quality star rating, obtain other information, and compare hospitals on Hospital Compare website. The overall hospital quality star rating includes 64 of the measures displayed on Hospital Compare website. For your convenience, I have included a link to Medicare Hospital Compare website on this slide. Measures that are used in calculation of overall star ratings are divided into 7 categories: mortality, safety of care, readmission, patient experience, effectiveness of care, timeliness of care, efficient use of medical imaging. Now we will talk about the measures that are included in these 7 categories. First is mortality. So the measures for mortality are death rate for heart attack patients, death rate for coronary artery bypass graft surgery patients, death rate for chronic obstructive pulmonary disease patients, death rate for heart failure patients, death rate for pneumonia patients, death rate for stroke patients, deaths among patients with serious treatable complications after surgery. Next category is safety of care, and its measures are CLABSI, which stands for Central Line Associated Bloodstream Infections, CAUTI, which stands for Catheter Associated Urinary Tract Infections, surgical site infections from colon surgery, surgical site infections from abdominal hysterectomy, MRSA, blood laboratory identified events, C. diff laboratory identified events, rate of complications for hip/knee replacement patients, serious complications. For readmission category, the measures are hospital return days for heart attack patients, rate of unplanned readmission for coronary artery bypass graft surgery patients, rate of unplanned readmission for chronic obstructive pulmonary disease patients, hospital return days for heart failure patients, rate of unplanned readmission after hip/knee surgery, hospital return days for pneumonia patients, rate of unplanned readmission after discharge from hospital, and this is hospital-wide measure. Next category is patient experience, and its measures are patients who reported that their nurses communicated well, patients who reported that their doctors communicated well, patients who reported that they received help as soon as they wanted, patients who reported that staff explained about medicines before giving it to them, patients who reported that their room and bathroom were clean, patients who reported that the area around their room was quiet at night, patients who reported that they were given information about what to do during their recovery at home, patients who understood their care when they left the hospital, patients who gave their hospital a rating on a scale from 0 to 10, patients who would recommend the hospital to their friends and family. There are 9 measures in effectiveness of care category, and which are patients assessed and given influenza vaccination, percentage of patients who left the emergency department before being seen, percentage of patients who came to the emergency department with stroke symptoms who received brain scan results within 45 minutes of arrival, percentage of patients receiving appropriate recommendation for follow-up screening colonoscopy, percentage of patients with history of polyps receiving follow-up colonoscopy in the appropriate time frame, percentage of mothers whose deliveries were scheduled too early, like 1 to 2 weeks early, when a scheduled delivery was not medically necessary, percentage of patients who received appropriate care for severe sepsis and septic shock, patients who developed a blood clot while in the hospital who did not get treatment that could have prevented it, percentage of patients receiving appropriate radiation therapy for cancer that has spread to the bone. For timeliness of care, the measures are average time patients spent in the emergency department before they were admitted to the hospital as an inpatient. Average time patients spent in the emergency department after the doctor decided to admit them as an inpatient before leaving the emergency department for their inpatient room. Average number of minutes before outpatients with chest pain or possible heart attack who needed specialized care were transferred to another hospital. Average number of minutes before outpatients with chest pain or possible heart attack got an ECG. Average time patients spent in the emergency department before leaving from the visit. Next category is efficient use of medical imaging. The measures are the percentage of outpatients with low back pain who had an MRI without trying recommended treatments first, such as physical therapy. Percentage of outpatient CT scans of the abdomen that were combination scans. Percentage of outpatient CT scans of the chest that were combination scans. Percentage of outpatients who got cardiac imaging stress test before low-risk outpatient surgery. Percentage of outpatients with brain CT scans who got a sinus CT scan at the same time. CMS collects data on these measures through Hospital Inpatient Quality Reporting Program and Hospital Outpatient Quality Reporting Program. Some of this data is claim-based, such as mortality, readmission, complications, patient safety, and imaging efficiency measures, and they are obtained from Medicare beneficiaries, whereas healthcare-associated infection, process of care, and HCAHPS measures include data from all payer types. On this slide, you will find references for the content of this PowerPoint presentation. Thank you for watching. See you next time.